Scientists, along with the World Health Organization, say there is no scientific basis for banning travel from South Africa over the Covid-19 Omicron variant. The UK, other European nations and the US have initiated travel restrictions. This is despite the fact that many of those countries have far more Covid-19 cases than South Africa at the moment. British High Commissioner to South Africa, Antony John Phillipson, joins us now for an update on that situation. High Commissioner, thank you for your time. I guess let's start with the latest, with you clarifying what the status is. South Africa firmly on the red list, but the ban on flights from South Africa has been lifted. Do I have the situation correctly?
Well, thank you very much for having me on the show. And so, yes, when we made the decision on Thursday last week, the necessary precautionary decision to put South Africa back on the red list because of the identification of the Omicron variant, there was an immediate feedback, during which time we were able to set back up our red listing system with managed quarantine. And so, although flights actually continue from the UK to South Africa, BA and Virgin understand will be restarting their flights from South Africa back into the UK as of Wednesday this week. Entry will be restricted, I'm afraid, to those who are either UK or Irish nationals or have rights of residence. And those who enter will have to undergo the managed quarantine in hotels for 10 days. But those flights will resume, yes.
So, High Commissioner, you will have seen, and I don't think I need to tell you about the sharp reaction, not only here in South Africa, but in many parts of the world, really, to this decision. The main theme that keeps coming forth is that there is no scientific basis for travel bans such as the ones you initially imposed, such as the flight restrictions that you initially imposed, and even the red list decision being criticized. What is the justification from the UK government perspective?
So I think the first thing I would say is this is not a decision that we took lightly. It was a decision that we took quickly because of the concern that was being expressed by scientists all around the world, not just here in South Africa, about the nature of this new variant. And now we call it Omicron, but as of Wednesday, Thursday last week, it was a variant of interest for the UK health authorities. And we simply didn't know, we still don't know really how much of a risk this poses to our public healthcare systems, especially to the vaccine programs that all of us are so reliant on. The other thing I would say, though, is that if you go back through the course of this pandemic, starting in March last year, and of course, you know, this has been a long 18, 19 months since we all went into this. A number of countries have had to react in certain ways to restrict travel between themselves and other countries. The UK is not unique in this. When I arrived to take up my posting in September, South Africa was still on the previous red list, and I certainly heard loud and clear then that there was a sense that the public health concern then had been outweighed by the economic impact that it was having. And we were able then to take South Africa off the red list. What happened literally over the last week is suddenly a new variant comes along. We don't understand the public health challenges that it poses. So we have acted to give ourselves a little bit more time to keep the variant out of the UK. As you said in your opening remark, we'll have a very high case rate, but we are unable to understand the risk posed by the existing variants. And what we simply don't know, and what we now need to work through at pace with our scientific colleagues here in South Africa and around the world, is to understand the nature of this variant. What does it pose in terms of a challenge to transmissibility, to severity of disease, to hospitalization, to deaths, and crucially, how do our existing suite of vaccines handle the challenge posed by this variant in particular?
What's the conversation happening within the UK government, High Commissioner, around the controversy of the countries that have been put on that red list? I had a look at it. I mean, I'm seeing 6 countries, all of them in Southern Africa. South Africa, Botswana, Eswatini, Lesotho, Namibia, Zimbabwe, and I think you've added a few more since then. Angola and Zambia are the other names that are there. You simply don't see, countries such as Italy, where it's been detected. You don't see Germany, where there's been a case as well. Czech Republic, you don't see Hong Kong being added there. You will have heard the criticism and the disparity that is being pointed out.
So yes, we hear it loud and clear, and I want to be very, very clear. This is not a South African variant, as some have said. This is a variant that was identified here. I think it's very important that this does not lead to stigmatizing of South Africa or Southern Africa. As you say, there are currently 10 countries on the UK's red list that set up over the last few days. They are all in Southern Africa, but that is because where the variant has been identified. The other countries that you mentioned, including, of course, the UK, where we have identified, I think, 3 cases so far within England, but they are specific cases. They are all cases related to travel from Southern Africa. That is also the case for the case that was identified in Hong Kong, unlike here in South Africa, where unfortunately it seems already clear that the variant is into the community. There is community transmission. That is not the case in those other countries. But, we will keep this all under very, very close review. The Prime Minister spoke to President Ramaphosa on Friday and made very clear that he regretted the necessity of this action and that he would be reversing it as soon as it was possible for us to do so. We are very aware of the impact that this has on South Africa's economy, especially its hospitality sector, its tourism industry, where the UK is the #1 source of tourists. So we do not want to be in this position for any longer than we have to, which is why we now need to work fast and work together to understand the challenge that this variant poses to us. What is the best public health response as we all work forward together?
Yeah, and High Commissioner, just lastly, you allude to the impact on the tourism sector, and you rightly point out that the UK is the #1 incoming tourist source. Destination, people coming from the UK coming into South Africa, numbered some 430,000, I'm told, in 2019, with massive contribution to the South African economy. What's the status now? Just to recap then, only those people who are UK or Irish citizens can travel to the United Kingdom, and even those still need to quarantine for about 10 days after landing, with all of those implications financially, including, at their own cost. That also has an impact in terms of people in the UK considering coming to South Africa for a bit of a stay, because when they go back to the UK, all of those costs that will be incurred.
So again, you have set it out factually, and that is all we can do. UK Irish nationals and those with a right of residence within the UK will be the only ones allowed entry, and even those will have to quarantine for 10 days. Again, the UK is not the only country that has operated a quarantine system. Indeed, there are some countries who have operated it throughout the whole period. And we fully understand that the cost of that, the inconvenience of that, will be a deterrent. So yes, we understand there will be an impact on the number of tourists who fly from the UK to South Africa. And that, of course, has a regrettable impact on South Africa's economy, which is why we will want to be able to reverse course on this, to move back to more open travel, as we have seen over the last few weeks since South Africa came off the previous red list around about the middle of October. We will aim to get there as fast as possible, and we will work as closely and collaboratively with our South African colleagues as we can in order to get there.
All right, I've got to thank you for your time. That's the High Commissioner to South Africa, the UK High Commissioner to South Africa, Antony Phillipson, weighing in on that situation that has been unfolding in the last few days.